Hi, this is Salina, and today's video is going to be about Medicare. And this video is going to try to keep things simple. We're going to talk about original Medicare, we're going to talk about Medicare Advantage, prescription drug plans, and Medicare Supplement, and also a little bit about Medicaid. So there are all these different terms, and we're going to make it clear in this video. But before we get into the subject matter of this video, please take a moment to like our channel, subscribe to our channel, hit the notification bell, and if you have any questions or anything, drop it in the comment section. I'm going to be reading through those comments and trying to answer them as best as I can. The first thing is, when you turn 65, the vast majority of people will move into the Medicare system. Most people that will move into the Medicare system will be people who have turned 65 and they have at least 40 work credits through the Social Security system, which typically means that you filed at least 10 years worth of tax returns. When you turn 65, you really don't have a choice to move into this Medicare system unless you are still working at your company and you have a group insurance with your employer. So once you turn 65 and you move into Medicare, there's a whole nother world of insurance that you need to understand. So the first step is going to be getting your Medicare Part A and Part B. Now, the Medicare Part A and Part B has certain ways that it works, and it's going to they're going to send you a red, white, and blue card. It is called a Medicare card, and this is also called the Original Medicare. And Part A covers hospitalization, and Part B covers your doctor visits and outpatient services. So how it works is it doesn't cover 100%. So if you were to get hospitalized, how Part A works is you have to pay a Part A deductible. And as of this recording, right now is 2022. We're in September of 2022. So right now for 2022, the way that it works is you have a $1,556 deductible when you get hospitalized. Now, this is not a yearly deductible. It is a per incident deductible, which means if you go in the hospital, even if it's just 1 or 2 nights, you're going to pay that deductible. And then after that, you're going to have to start that over. If you, let's say, for example, you were to get discharged from the hospital and then 6 months later you go back in the hospital again, you have to pay that deductible again. They have a certain period of time that if you're readmitted is considered the same incident. So they call that a benefit period. Okay, so that time. Now, this is shocking to a lot of people because that's not how they're used to seeing their insurance work. But that's how it works with Medicare. That is original Medicare. Now, there's a lot more detail to Part A, but that's the general idea of how it works. Now with Part B, that is going to be your doctor visits, all your outpatient stuff. 2022, the Part B deductible is $233, which means that if you go to see the doctor or do any type of outpatient, x-ray, ultrasound, MRI, colonoscopy, all those things, you're going to pay a $233 deductible. And then after you finish that is an annual deductible, you're going to pay 20% of the rest of your medical services. Now with original Medicare, that 20% is everything. It does not cover your traditional annual physical that you're used to doing with your mammogram and colonoscopy and all those things. You're going to pay 20% for everything. Even the consultation with the doctor, you pay 20% of the office visit. So 20% of everything after a $233 deductible. So this is how original Medicare works. Now, Part A, the hospitalization, is normally free for seniors who have worked and have the credits. They qualify, the 40 work credits with Social Security system. Now, the Part B is going to cost $170.10 in 2022. That rate goes up a little bit every year. It's like $148 last year. This year it went up to $170.10. So that can be another shocker to a lot of seniors when they move into the Medicare system. They're like, well, I gotta pay this. Now, the thing is that goes up every year too. So now some people, you may hear them say, well, I don't pay that. Well, it could be that they have Medicaid. Medicaid. So some seniors have Medicare and they have Medicaid. So for low-income seniors, they can qualify for Medicare Savings Program, also known as Medicaid in most states, and there are different levels of Medicaid. There are different levels of Medicaid, but if you qualify for any of those levels, they will pay that $170.10. To qualify for Medicaid for low income, it means that you have under a certain amount of monthly income, and you also have under a certain amount of resources, meaning your savings, your cash, checking, savings, 401k, IRA, stocks, bonds, mutual funds, all those things. So if your resources are low and your monthly income is low, then you may qualify for this extra help. So that $170 is not a choice. Now, if you are eligible for Medicare and you don't enroll when you're supposed to enroll, they also have penalties involved. So that's called a Part B enrollment penalty. So you have to do it when you're supposed to do it. And the enrollment time to do that is 3 months before your 65th birth month. So if your birthday is October the 10th, then your Medicare should start October the 1st. And you can start applying for Medicare and getting the paperwork all done with the Social Security system. You should start working on that 3 months before October. And they give you up to 3 months after your birth month, in this example, October. So November, December, January. By January, the end of January, 3 months after your birth month, you're considered late. And that's when they start assessing those late enrollment penalties. Now, if you have job insurance, you can go ahead and take the Part A and don't take the Part B. So you can delay your Part B as long as you have what's called creditable coverage. And if you have insurance through your job, you're still working, then you don't have to get the Part B right away. But if you're on Obamacare, or if you're on COBRA, or if you don't have insurance and you qualify for Medicare, you need to do it when you're supposed to do it, because those things are not considered creditable coverage. As a matter of fact, if you're on Obamacare, which is a marketplace plan, which is you're going to get kicked off of that if you are receiving any type of credit. You're not going to continue to get that insurance. So you need to go ahead and move to your Medicare Part A and Part B system. All right. So then the next thing is, what doesn't it cover? So it doesn't cover a lot of things. It doesn't cover dental. It doesn't cover vision. It doesn't even cover your prescription drugs. So what's going to happen is, when you get your Medicare, your original Medicare, you also have to take a prescription drug coverage. There are standalone prescription drug coverages, and there's also what they call Medicare ADVANTAGE with prescription drug coverage. So you can get prescription drug coverage either way, but your old discount card is not considered creditable prescription drug coverage. So you need to get a prescription drug coverage plan. Now, if you don't enroll in your Part D, D for David, D for drugs, that's how I remember it. Part D is your prescription drug coverage. If you don't get prescription drug coverage, when you get your Medicare A and B, there's also another penalty for not doing that on time. So those penalties are serious penalties, because they are not one-time penalties. They are monthly penalties that you pay for the rest of your life, as long as you have a Part B or Part D, once you figure out you should have enrolled into it. So now, once you get your original Medicare, which is your Part A and Part B, you're going to get this red, white, and blue card. Now, once you get this red, white, and blue card, because it doesn't cover all these different things that I just mentioned, there's mainly 2 routes that you're going to take after that. And keep in mind too, when you get ready to turn 65, I don't know how, but the whole world knows you're turning 65. You start getting all kind of phone calls, telemarketers calling you, mail coming in the mail. Some of them look official, some of them sound threatening, and there are just marketing tactics, okay? So it's best if you have a trusted agent, you can work with them. You know, I tell my clients all the time, just don't answer those telemarketing calls. Don't believe in any letter. Take a picture of it, send it to me. Let me see what it is, and let's see if it's official. Most of the time, official departments are not going to call you on the phone like that, or you will know a Social Security letter when you receive it. But sometimes people still look at those things and believe that they may be official, and they may be. But so it's good for you to have someone review it and make sure that it's not some sort of advertisement or a scam. But somehow you will get calls all day and night when you get closer to 65 years old. There's two main routes to take after you get your original Medicare Part A and Part B. And there are other ways to go about it, but I'm speaking to the vast majority of the population and the most popular routes to take. One is called a Medicare ADVANTAGE, and then the other one is called Medicare SUPPLEMENT. Okay, so Medicare ADVANTAGE is also known as Part C. Okay, Part C, and Medicare SUPPLEMENT is also known as Medigap. So there's Medicare Supplement or Medicare Advantage. The best way I can describe the difference between a Medicare Advantage and a Medicare Supplement was when I was in training. This is how somebody explained it to us. They say it's kind of like you go to a buffet or you go to a restaurant, right? When you go to a buffet, you pay a fee and then you eat whatever you want. But if you go to a restaurant and you pick from the menu and then you pick each item you want to buy and then you pay a la carte, that's kind of like a Medicare Advantage plan. So Medicare Supplement is like the buffet, and Medicare Advantage is like getting a la carte. You pay for what you eat. So let me explain it this way as well. So Medicare Supplement, many Medicare Supplement plans are going to be people who can afford them, okay? Medicare Supplement will have an additional monthly fee. So I'm talking about Medicare Supplement. Medicare Supplement, also known as Medigap, has an additional monthly fee that you're going to pay. And there are different plans. There's Plan G, Plan N, Plan K, Plan L, and Plan G is the most comprehensive plan. So let me explain how Plan G works. Mainly what happens is you pay a monthly fee for your Plan G, and you get this through an insurance company, so many different companies. So you get your Plan G through an insurance company, and then you pay a monthly fee for it. It may be $100 and some odd a month on top of your $170 from the Medicare Part B. So there's an additional fee. And then when you show up at the doctor, you're going to show your red, white, and blue card, and you're going to show your supplement card. And the supplement card is going to pick up everything that the original Medicare plan did not pay for. So they're going to pay all that 20% of everything. They're going to pay everything if you're hospitalized. The only thing that you will be responsible for the entire year is the $233 outpatient doctor visit deductible, the annual deductible of $233. So once you have paid the first $233 from, let's say, the first time you go to the doctor, then they will cover everything else for the rest of the year. This is a typical Plan G, Medicare Supplement, also known as Medigap. Okay, so Medicare Supplement has a additional cost to it. Now, the Medicare Supplement also does not cover your prescription drugs. It doesn't include that. So then you're going to have to purchase an additional standalone prescription drug plan. And that's going to be another, maybe $10, $20, $30, $50 a month, just depending on which prescription drug plan that you choose. Unfortunately, Medicare supplement plans also do not cover dental and vision, so you have to purchase another dental and vision insurance if you want that type of coverage as well. So Medicare supplement is typically going to be, a little bit more out of pocket every month. You're going to see more bills, and that is one reason that it becomes a little bit prohibitive to a lot of people. So on the other hand, I was talking about the Medicare Advantage plans. Medicare Advantage is also known as Part C. All right. So many places and many areas where Part C is available, the Medicare Advantage can be only, it could be $0 to enroll into a Medicare Advantage plan. So that means that you don't have another monthly payment. But what happens is, as you go to the doctor, as you receive medical services, you're going to pay copay as you go. So you'll get a benefit summary, and it'll say for each service, kind of like a menu, and you're choosing a la carte, you pay a copay for every service that you receive. So if you go to the primary care, it may be $5, it may be $10, or it may be $0 copay to see the primary care doctor. And then if you see a specialist, it could be $30 or $40 or $50 to see each visit to see a specialist. If you go to emergency room, maybe it's $90 or $100 copay to go into the emergency room. If you go to urgent care, maybe it's $30 or $40. And the Medicare Advantage plan basically has everything is copay, 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 copay. There are some Medicare Advantage plans that may have a percentage, which is called co-insurance, maybe like 20%, but it cannot be more than 20% because a Medicare Advantage plan cannot be structured to where the benefits are any less than original Medicare. So if you take a Medicare Advantage plan, you're going to get an insurance card because you purchase that from the insurance company, or you get enrolled into it. Some Medicare Advantage does have a monthly payment, but many of them are available at $0. Now, it just depends on where you live and what's available in your area. The bigger the city you're in, the more competition. A lot of times those big city, big area, metro areas will have $0 plans available. So when you get the Medicare Advantage plan, you don't need to show your red, white, and blue card when you go to the doctor. You're only going to just show your Medicare Advantage plan. Now, many of these Medicare Advantage plans include the prescription drug coverage. So for $0, you're getting a Medicare Advantage plan, and it includes your prescription drug plan. Now, if you take a Medicare Advantage plan and you don't take, because there are some Medicare Advantage plans that do not have prescription drugs. So you can't take a Medicare Advantage plan without the prescription drug and then purchase a separate prescription drug plan. That's not allowed. So if you need prescription drug coverage, which you do, you're going to get a penalty if you don't have it otherwise. You want to get a Medicare Advantage plan that includes the prescription drug coverage. There are some examples where people will get into a Medicare Advantage plan without the prescription drug coverage. And that, I could give you a simple example. Let's say someone that goes to the VA hospital for their services, they are a vet. They will have prescription drugs there. So they don't need to take a Medicare Advantage or prescription drug plan. So that's just an example, but the majority of people are going to want a Medicare Advantage plan that includes the prescription drug coverage. Many Medicare Advantage plans include dental, they include benefits like vision, they may include some over-the-counter supplies, they may include gym memberships. And so these are the things that you see all the time on the commercials, and they just sound so good, because they say they're going to get this benefit, that benefit. Some of them even have something called a give back, which is where they will give you $30 a month back, $50 a month back. Basically, they give you money every month to enroll into their plan. And they call it a give back because you're paying that $170.10 every month in 2022 for your Medicare Part B. But these insurance companies entice you to enroll in their plan by giving you money back. So if you just remember that, as with anything, when there is more benefit on one side, they're going to take something from the other side. So for example, if they have a give back, it means that plan probably has higher copays. It could have less dental benefits, less vision benefits, less over-the-counter supply benefit. Maybe they don't have transportation benefit at all. So anytime they give you more on one side, they're going to take away on another side. So that's just how things are structured, right? You can't have it all in one plan. So when you're shopping for a Medicare Advantage plan, you have to understand that they have what's called networks, right? So you have HMO, PPO, but at the end of the day, they're going to have a network. A network is a list of doctors, facilities, clinics, pharmacies, hospitals that you are going to be able to get your services from, your medical services from. So if you have doctors that you like and you don't want to change them, then it's important when you're shopping for your Medicare Advantage plan to choose one that has your doctors in the network, right? And then also they will have a certain cost associated with every medication. So that's on what's called a formulary. A formulary is a list of drugs that each plan covers and how much you're going to pay for each drug. And they're usually divided like tier 1, tier 2, tier 3, tier 4. So your medication may be tier 1 or your medication may be tier 2. And it could fall on tier 2 at one company and tier 1 on another company. So the higher the tier, like tier 3, tier 4, tier 5, those drugs are going to cost more. And tier 1, tier 2, they usually are your generics or your lower cost medication. So you want to know like your medicine, how much it's going to pay if you get enrolled into any particular Medicare Advantage with prescription drug plan, or even if you take a standalone prescription drug plan because you go with the Medicare Supplement. But the main thing is to know that the Medicare Advantage has networks, and also certain types of services that you receive, they may you may have to get a prior authorization before you get those services. So this is one of the reasons why some people like Medicare Supplement better than they like Medicare Advantage, and it may suit some people to get Medicare Supplement. Medicare Supplement, you don't have to deal with the HMOs and PPO networks. With Medicare Supplement, you can go anywhere in 50 states that takes your original Medicare card. And anyone who takes original Medicare, the Medicare Supplement just gonna fill in the gaps and pay all those the 20% coinsurance and anything above your deductible that the Part A and Part B doesn't cover. It depends on the Medicare supplement plan that you choose. Remember, I said there's like Plan G, Plan K, Plan N. So you need to know what you're going to pay and what you're not going to have to pay when you get a Medicare supplement plan. So this is the difference between Medicare Advantage and Medicare Supplement. I hope that this helps you when it's time for you to turn 65, and make sure that you have a trusted, knowledgeable agent that you can work with. And there are in the industry different types of agents. Some agents are what we call captive agents, which means that they will only provide you with information and be able to enroll you in the company that they're working for. So if they work for a particular insurance company, they're not going to be able to help you with other companies, their competitors. They're only going to be able to sell the insurance for the insurance company that they work with. So it's good to work with a agent that is non-captive, an agent that is an independent agent that can shop around for you and help you find the best plan for you. So when you have to make this decision about whether you want to go in Medicare Advantage or Medicare Supplement, one of the common things that I hear a lot of seniors say, well, that's not fair, I have to pay all this money, especially if they're moving out, if they're kind of lower middle income and they're coming off of their job insurance or they're coming off of Obamacare. They are typically paying less there and then have to end up paying more with Medicare. So one of the things that we want to try to see is, should you go and apply for the Medicaid? Because if your income is below a certain point, if your resources are below a certain point, you may be able to qualify for Medicaid, and different levels of Medicaid can help you to pay that monthly payment for your Medicare Part B. Secondly, many people end up with Medicare Advantage because they do offer so much in the packages, and they have $0 additional premium. So you just have to enroll into them. But the main thing is to understand, we still have to explain both, because sometimes people will say, well, right now I don't go to the doctor too much. I can't justify paying the extra money for a Medicare supplement plan. But you need to realize that you can, if you take a supplement and then 1, 2, 3 years later, you decide to switch to Medicare Advantage, you can do that very easily. But if you have a Medicare Advantage plan and then later you start getting sick or something, and then you need more services, and you those copay starts adding up on you, and you say, man, I wish I had a Medicare supplement plan. You can't just move to Medicare from Medicare Advantage to Medicare Supplement. When you want to get into Medicare Supplement, when you first turn 65, you have about 6 or 7 months. You have a certain amount of time that you can get into a Medicare supplement plan without any underwriting at all. What that means is they can't ask you any health questions or anything. You're automatically going to get their best rates. But after that initial period, if you try to go in 2, 3 years later, they're going to have a lot of health questions that you're going to have to answer. And if you are more of a high risk type of person, they can decline you to purchase their Medicare supplement plan, or they can rate you, which means they can make you pay more than someone else. They'll make you pay more for the Medicare supplement plan. So it's just important to know that in case you even are considering getting into a Medicare supplement plan, but thinking that you can just do it later whenever you want. It doesn't work like that. Now with Medicare Advantage, you can get into a Medicare Advantage anytime during what's called the annual election period. So the annual election period for Medicare Advantage is October 15th through December 7th. Now, it's been the same dates for many, many years, but here now it's 2022 going into 2023. It's still October 15th to December 7th, but those dates could change. We don't know. So if you're watching this video years later, it may be different. But that is called annual election period, October 15th through December 7th. Now, during this time, you can change your Medicare Advantage plan to a different Medicare Advantage plan, and you can change as many times as you want. But the last one you enroll in by December 7th, that's the one you're going to get for the following year. So the effective dates on those enrollments during the annual election period, also known as AEP, it's going to take effect on January 1st. Now, between January 1st and March 15th, you have one more opportunity to change your Medicare Advantage plan. This is called open enrollment period, OEP. You have one opportunity to either change your Medicare Advantage to another Medicare Advantage, or you can drop your Medicare Advantage, go back to the original Medicare, and maybe take a supplement and get a prescription drug plan during that time. So, of course, if you're doing it and you're outside of the first initial 6-7 months after you've turned 65, then you're going to go through underwriting if you try to do a Medicare supplement plan. But if you are considering that, that is the time you can do that. So between January 1st and March 31st, you have one opportunity to change your Medicare Advantage plan, and you also have the opportunity to drop your Medicare Advantage plan if you don't want it and you want to go back to original Medicare, which most people don't want to be with original Medicare only. Another thing to mention is after you get into your Medicare Advantage plan and you've had it for a while, if you like your plan and come next AEP, which is the annual election period, you will have an opportunity to change if you want to, or you can just keep the same one. And what the insurance company will do is they will mail you something called an annual notice of change. And on that annual notice of change, they will talk about any changes that's going to happen to your plan. So make sure you review your annual notice of change and see, if you're going to be happy with any of the changes. The changes are not usually big changes, but it's still good to know that you don't have to take any action to renew your plan. It will automatically renew as long as that plan is still available. But just look at your annual notice of change to see any slight changes, and then contact your agent if you feel like you want to review other plans. When you first take your Medicare Advantage plan, you may not be able to qualify for Medicaid, but things can happen in our life that changes our financial situation. It could be that your income, let's say you're working and you stop working and all you're getting is a Social Security check, for example, then your income may drop. If your income drops, or if you feel like your income has dropped and then your resources are in the eligibility range, you can apply for Medicaid. Now, your agent should be able to also help you to do that. And if that happens, or sometimes you may even just get approval for Medicaid, make sure you contact your agent if you have a Medicare Advantage plan, because there are special Medicare Advantage plans for people who have Medicaid and Medicare. So we call those individuals who have Medicare and Medicaid dual eligible. And when you're dual eligible, they have special Medicare Advantage plans for you. So make sure you contact your agent to let them know that you have qualified for Medicaid now and that you want to look at those dual eligible plans. Thank you for tuning in to this video today and watching it all the way to the end if you made it this far. Make sure to like this video if you like it, and also subscribe to our channel, hit the notification bell, all those good things. And I love to hear from you. If you have any questions for me, drop them in the comments box as well.